Ugh, that's embarrassing. Apparently, my internet just cut out and I can't. I'm so bad at this. Oh my God. Yeah, minute 9-ish, I guess, and I went on for another 5-7 minutes. Anywho, hopefully some of y'all will forgive me in my ineffective techness. So what I was saying that was the Reproductive Health Care Act does a couple of things. One, it makes abortion not criminal. So we need this in Utah, for example. Evidence-based medicine should not be regulated under a criminal code. Not a big ask. I feel like that's appropriate. So that's one of the things that the Reproductive Health Care Act does in New York now. And I apologize because apparently there was a chat and I was not seeing it for the, and I've got to mess that up too. Awesome. Well, chat at me, maybe. Yeah, I'm just not, I've been out of the game too long. It's not good. The other thing that the Reproductive Health Care Act does is it allows more access to healthcare. I mean, laws should be promoting access to healthcare, not prohibiting it. I'm looking at you, Utah, because evidence-based medicine everywhere else generally promotes access to awesome healthcare that is guided by evidence-based medicine as regulated and guidance provided by the American Medical Association, the World Health Organization. In my specialty, for example, the American College of Obstetricians and Gynecologists. Those are the folks who are doing the work of the understanding of the medicine, of the knowing what the research is doing and how to apply it. Those are the experts. My lawyer, politician, representative doesn't know how to perform an abortion, doesn't know if antibiotics are needed or not, doesn't know what size cannula to use, doesn't know if the abortion should be performed in a hospital because it's safer, or if it's safe to perform in a clinic. No, they don't. And they make laws telling me that I'm not allowed to perform an abortion in the hospital, even though it would protect my patient's life. Because to them, the law is the law, and they're just going to make a law based on their feelings about reproductive health and pay no mind to what medical experts and authorities in the field have to say about it. That's not okay. And so what New York has done is said, you know what? We agree it's not okay. Here's a new law saying evidence-based practices need to be available and accessible. And they need to not be penalized or criminalized. That's all the law does. And I ask anyone to come forward and express your discontent with people having access to the care that they need. Because what's not happening is people going through pregnancy and then one day in their third trimester waking up and being like, I'll have an abortion. Forget this whole giving birth thing. That doesn't happen. It's not happening. It's not going to happen. That is willful ignorance of the issue, and also a bit judgy, and just doesn't make any sense. It's nonsensical. So don't let people's feelings about abortion misguide what is actually happening, and don't allow misinformation to perpetuate. It's just, I mean, I'm at the point where it's just period, the end, done. Like, this is how it is. And you can not accept that fact, or you can accept that fact. It's not about beliefs. It's about agreeing with, or accepting or rejecting, rather, the facts. And that's the only way we're going to move forward. That's the only way we're going to reduce our maternal mortality rate. That's the only way we're going to help all of these kids in foster care get to the safe and loving homes that they need to get to. Why is Utah's hungry child rate higher than the national average if Utah cares so much about children? Why are our schools overcrowded and teachers so underpaid that I can't even tell you how many school days are just like not happening because Utah can't pay the teachers, and the teachers therefore aren't educating the kids, and the kids are therefore not getting an education. They don't have enough lockers. They don't have enough classroom space. They don't have... Where is that caring? Where's the funding for schools? Where's the funding for food for our children? Where's the social programs that help get children the care and security and safety and food and shelter that they need? Don't talk to me about how you don't like the fact that someone who's just had a horrible diagnosis in their third trimester needs an abortion until the 5-year-old that lives down the street has enough to eat every day. Sorry, it's just, you don't get to intervene in somebody else's family planning until the community is taken care of. It just makes no sense. If you care about children that much, let's focus on the children, shall we? And let someone with a uterus make decisions about that uterus and its contents. I think that's appropriate. Oh, the other thing that the Reproductive Health Care Act does, my chat has gone. I guess if you have questions, please at me on Twitter, because I don't know where my chat box is not there. I'm sorry, I messed it up. That you don't have to be a doctor to provide abortions. And guess what? If I can teach medical students how to do an abortion, qualified nurse practitioners, physician assistants, etc., can provide abortion care. Now, that is not to say that someone who isn't qualified to perform abortions is going to be performing abortions. That's not what that says. You have to be trained and comfortable with a procedure before you perform it. That applies to anything in medicine, whatever level you are: physician, physician assistant, nurse practitioner, etc., etc. It's just common sense and common knowledge in medicine that someone who isn't comfortable performing a procedure isn't performing it. Yet you don't see laws all over the place saying the gynecologist can't perform a heart transplant. Well, of course you don't, because you don't have gynecologists trying to perform heart transplants, because we don't do that. I'm not comfortable with that procedure. So all it's saying is that someone who's qualified to perform an abortion can and should do, doesn't necessarily need to be a physician. They have to be qualified, but being a physician isn't one of those qualifications. Again, if I can teach a medical student to perform an abortion, you don't have to be a doctor to perform an abortion. Just like with any procedure, with the right training, you can perform an abortion. Psychiatrists don't do procedures, yet they can be trained to do abortions. They're physicians. But that's just an example of it takes training, and that is appropriate. But that training can be acquired without having to go through 4 years of med school, 4 to 8 years of residency or whatever. If you're appropriately licensed and appropriately trained, you can perform an abortion. Chances are you're going to have a physician assistant who's probably not going to go beyond 12 weeks. And that's fine, right? There are physicians who don't go beyond 12 weeks in their abortion care, and that's fine. There are providers who don't go beyond medical abortion, and that's fine. It's the comfort level. We don't need laws regulating the oncologist doesn't perform cognitive behavior therapy. I don't know. Like, these laws don't exist for a reason, because it's ridiculous. So why would they exist in reproductive health care? I can tell you several theories why. Let me check Twitter and see if anybody has any questions. Oh, the other thing I wanted to mention, I can't remember if I mentioned in part one. Go to rhavote.com if you have questions about the New York law. Also on Twitter, at rhavote has been a tremendous force in getting this law passed, in promoting access to evidence-based medicine, in ensuring that people have access to the care that they need. Again, I don't think that these are unreasonable asks. I don't see any comments on the Twitters. So there you have it. Are there any questions? I don't know. It seems straightforward to me. Make sure that people can get to a doctor when they need to. Make sure they aren't meant to suffer or forced to suffer and undergo traumas that are unnecessary, like, oh, I don't know, giving birth to a baby that isn't going to survive and having to watch it suffer and die. Sounds pretty reasonable, pretty humanitarian. I'm going to leave it there. Feels like doing this the second time. Hopefully my internet kept going. There should be like a thing that comes up on the screen here that I'm staring at that says, by the way, no one's watching you because you've gone offline. But that did not happen. So my apologies. Thanks again for joining. I'll sign off again, even though you didn't see it the first time. Leave comments, questions, anything that you want to discuss or hear about or have questions about, myths that need to be debunked. Subscribe, tell your friends, be nice, be kind. People are people. Let's ratify the Equal Rights Amendment because people are people and should be treated as such. There's a video coming regarding how I am under different I have different rights under the Constitution depending on what state of the nation I'm standing in. That video is coming, so pay attention to Virginia. Ratifying the Equal Rights Amendment is super key, and all that is saying that the Constitution applies to people equally regardless of their gender. Crazy idea, I know. All right, bye guys. See you later.